Hello, my name is Dr. John Bartsch. I'm a doctor of chiropractic, and I'm here to help you redirect your well-being.
Welcome to the Redirect Podcast. We appreciate you joining us and listening to our conversation about finding your purpose in retirement. This is Curt Brewer, and I'm with Dale Tesmond and Adam Kalemba. How you guys doing today?
Good morning, Curt. How are you?
Really pumped about today. It's going to be a good day.
Yeah, it's going to be a great day. We're very fortunate today to have a good friend of ours, John Bartsch, who's going to be talking to us about your well-being and structure and aging. So why don't I give a quick little bio of what John's all about. In 1998, John moved to Cincinnati and began his chiropractic practice. Dr. Bartsch has served his profession in numerous leadership roles, both locally and statewide. He was president of the Southwest Ohio Chiropractic Association from 1990 to 1991, and he served as director of the chiropractic division of the medical staff at Epp Memorial, now called Jewish Hospital of Cincinnati, for 19 years. During his 30-plus years in practice, Dr. Bartsch has provided care to thousands of patients in the greater Cincinnati area and is regarded by his peers as one of Cincinnati's top chiropractors, as published in Cincy Magazine a number of times. Dr. John Bartsch has enjoyed an affiliation with Alliance Integrative Medicine, AIM, located in Kenwood, Ohio, since its founding, providing traditional, gentle chiropractic manipulation, as well as strain counter-strain technique for soft tissue, myofascia trigger point therapy, and the activator method, an instrument-assisted technique. He is also a certified provider of frequency-specific microcurrent and advanced allergy therapeutics. John, we welcome you to today's talk.
Thank you. I appreciate that.
It's nice to have you here.
And nice to be had.
I'm not sure there are three more people that really need to hear from you today. So we're really
And what's really cool is that John is now sitting at my table because generally I go to his table because he's my chiropractor.
You get to manipulate him now.
Now I get to manipulate him, right? But he's really good at what he does.
That's right. All right. Well, hey, let's get into it, John. Thank you for. Can I call you John? Do I have to?
Your Highness sometimes works, but
okay.
John is good.
Your supremacy.
Your supremacy, yes.
Yeah. So John, we've had on one of your colleagues from AIM. Really enjoyed that conversation. Yes. But for those who don't know much about AIM, tell us about that first.
So AIM was a concept from two MDs in the area. They were a husband and wife team, Steve and Sandy Moyles, originally from South Africa, and they had a concept of medicine beyond their training. They knew there were other healing modalities out in the world that they had not explored, but they knew had worked. And so they set about going around the globe, going to many of these places, and they've always wanted to start an office that really integrated many of those alternative therapies in addition to the standard medical training that they had received. And what they call that is integrative medicine. You integrate the allopathic with those things that aren't allopathic, the alternative therapies. And that started 25 years ago, and it's morphed into several different things over the course of that 25 years. But we now have not only 6 MDs, we have a couple of MD fellows that have just joined us within the past year, and 3 chiropractors. We just added a 4th as of yesterday. For massage therapists, we have who you had on earlier, Deanna, health coach. We also have 2 nutritionists as well. The integration of that has been so nice because even though you may not have all the tools yourself, you've got access to a lot of tools that can help your patient, maybe alternatively to your care or additionally to your care. So it's really a spectacular place to be because there really is integration of the care.
And I believe it's prescriptive that they look at you, the person, and identify all the things that could complement one another in your services to create a program, correct?
Yes. We look at the patient as they come in, and we really they go through a pretty extensive questionnaire, as you know, Curt. Mm-hmm. And many of the questions a lot of patients look at and say, what is all this about? Some of these questions that have nothing to do with my sore shoulder or whatever. But they integrate a lot of the concepts of all the therapies there, such as the acupuncture and the energy work. So they give us a better outline of what is happening with this patient, not only physically, but emotionally and spiritually. And we look at the patient as a whole rather than a part that is injured or that is having an issue with, let's say, a gut issue or shoulder or whatever it might be. And that's unique in this city. Everything is so compartmentalized in your allopathic medicine care. So patients really enjoy that they're heard and that they are looked at as the whole person and realizing that other aspects can influence their health. Many don't realize the stress that they've been under is what's really causing their back pain or their gut issue. And if you don't address that, you can throw all kinds of medicines at it, nutritional supplements, and it will not have an effect unless you deal with the underlying emotional issue that's there.
So it reinforces something that I learned a long time ago, that the foot bone is connected to the leg bone, and the leg bone is connected to the hip bone. And
it is indeed, yes.
It's all interconnected.
So you played Operation too.
That's right.
Good.
Everything he knows about anatomy comes from that little game.
Yes. One of my favorite quotes, and I can't remember who it's from, but is that every organ in the body is connected to the one under your hat.
So true. So true.
When somebody comes in, what percentage of the people that do come in find out that what they've come in for is really being caused by something else? Is that something that is just common with everybody, or?
It's not that uncommon. A higher percentage, really, because they've been, more often than not, they've been to other places. They've been to their standard family practice doc or even a specialist and had gotten really no real answers and really felt like there really was no connection between them and the physician. He wasn't really connecting to what's their life about, what are the issues that are going on around the injury or whatever it might be. And so they just do not feel listened to. So they've done some of their exploring online and discovered some of the treatments that we do, and it seemed to match up with what they felt like that would be finally helpful. So they're very open to it. They've already done everything else.
Obviously, our show here is called the Redirect Podcast, and we're dealing with an audience that is, 55 and up. And this segment we're doing with you is your well-being and structure and aging. So, it's sort of like a house comparison. When you go out shopping for a house, you got to make sure the house has good bones, right? So how do we keep our bones being where they're supposed to be going forward?
Well, number one is don't continue abusing it as you have.
But we're not 30
Abusing
anymore.
it more does not make it better.
Have we grown older?
That's right. That's right. Dale, you know very well, don't you? My goal is to have folks age and feel good the remainder of their life. You can still live your life. You can push it to some point, but pushing it to an extreme, you get extreme consequences from that. The number one key is knowing your body and responding to what you know. I don't try to do things I did when I was 25 because I'm not 25.
Okay. Yeah. Well.
And so, but I still want to do things. I'm very active, go to the gym and do other things. So I don't want to stop living, but I just have to be smart about how I do these things. So I don't want to end up as the patient. I just want to treat the people that forgot that.
And this is something that even Adam could do, being in his early 50s. It's a mere child.
Very
Recently graduated into my mid-50s.
Okay, well, congratulations.
That's
Fantastic.
not sure where his mind is, but we know where his body is.
That's right.
Yeah.
But here's the situation for him that, hey, you should be thinking about this when you're younger to make sure that you're not putting yourself in a different situation when you're older.
Right. And I have always looked at folks my age and maybe a little bit older. What does their gait look like? Do they look like they're in pain? And my goal has always been, I don't want to look like any of those friends of mine that look like that. Mm-hmm. So what do I need to do to either avoid it or make it hard for me to get there? So I know the power of chiropractic. I grew up in it, and I know that it's kept me away from a lot of the sins of my past as far as physicalness early on. So that, nutrition, regularly exercising, stretching, doing things that maximize what I've got without hurting it.
So help us find that place of good behavior for the average 62-year-old and then separately for the average 77-year-old. What can they be doing now? What would you recommend?
First thing is commit to it. Realize that you need to do it, and don't let anything knock that off from your commitment. Find the people that can help you in that commitment. So let's say you
accountability partner, so to speak.
Either accountability, not only accountability, but professional, to make sure that as you're doing it correctly, that you're not doing it to hurt yourself, or you're not taking anything that you really don't need to be taking, like say a certain supplement.
Got it.
That doesn't really benefit you. This one will. But you need that guidance. And everyone is unique in their needs. Some people might have prolonged gut issues that they need special care for that. Some people might have certain joint issues, like the ones that have been replaced in Dale over there.
Aftermarket. Yeah. Yeah.
Nothing but steel over here.
That's right. That's right.
Nothing
Man of Steel is truly
steel.
so everything's a little unique to their particular body. And commit to it. Find the right people to direct you and guide you. And always listen to your intuition.
Not your heart.
Right. I always tell them, if you're doing something active, there's two types of pain. The pain that hurts and the pain that feels good. You stay within the pain that feels good.
Interesting.
And avoid the pain that hurts, that injury pain. When your reflexive action is to back off, you stay away from those. But the pain that feels like, oh gosh, it hurts, but it feels good.
Like stretching, I think, a lot of times.
Stretching, or even sometimes, I don't know if you've ever had a massage, but my massage therapist, they find a lot of those points that hurt so good.
Yeah, I haven't had a lot of
They go, do you want me to back off? No. You're finding a spot, just ignore my moans and groans.
I haven't had a lot of legal massages.
I'm glad you delineated that.
You've had chiropractic care, have you?
I have. So I herniated a disc in my neck, almost 6 years ago. And prior to that, I hadn't ever been to a chiropractor. Trying to figure out what was wrong with my neck. I went to my general practitioner. He sent me to a specialist. I went to 2 different chiropractors. I went to another doctor. And seemingly such a simple, easily diagnosable thing went misdiagnosed by several people. Yeah. And I still don't know that I completely understand, so I look forward to us spending some more time together. That discipline, that medicine. But yeah, to answer your question, Curt, I have been to a chiropractor.
Okay. Dale, how about you? Have you used chiropractic service?
I have never used chiropractic service.
Wow.
Yeah, amazing. I was one of these guys that
there's no medal. We have no medals to provide for Dale. So.
Yeah, that's right. However, I've done a ton of massage. I've done a lot of acupuncture.
Okay.
I'm the guy right now that I have a lot of people in my age group that have neuropathy, and every traditional doc out there is you're just going to have to deal with it.
Right.
You just got to deal with it. And that was taken up by Deanna, and I had a lot of conversations about that afterward. Mm-hmm. And it's my responsibility to go find it, to just not accept the fact that there's nothing you can do about it. I can do some laser treatment. I have one person that does acupuncture, and I've always used them.
Right.
But it's been apparently so clear on all the disc-related problems I've had in my neck. So many came from my long family history of bad neck, bad back, bad degenerative, that I've gone right to fixing it. Mm-hmm. So yeah, I've not been with a chiropractor because what I've done to my body over the years, from mountain climbing and triathloning and everything else, I've pretty much just used it up.
Right.
I want to follow up when you just talked about, Dale, that you haven't taken advantage of a chiropractic service. There are probably people listening that when they hear the word chiropractic, they think of snap, crackle, and pop.
Right.
And they're maybe intimidated. And plus, being older people, osteoporosis and arthritis and all this stuff, am I a candidate for chiropractor at 68 years old?
Oh, yes.
For the first time.
And beyond. From cradle to grave, you're a good candidate for chiropractic.
Okay.
As long as you have a spine, you're a good candidate for chiropractic.
And I have had chiropractic experiences for, I'm going to say probably about 15, 20 years. My wife is a big advocate of it. I started having back problems, And it helped, but then I got to a point where I've had 2 back surgeries. And I've learned how to take care of myself and how I lift things and how I rotate, and understanding that a strong abdomen creates a strong back. So I've had a lot of teachings, and I don't want to go underneath the knife again, because the next one's a fusion, and I don't want that. But I go to you as we take our car to get an oil change after so many miles. I need a tune-up. I need a refinement. And my wife will say, hey, you're walking crooked. And then I'm like, hey, John, need to come on in and see you. Yeah. And we fine-tune things. So working with somebody to correct a problem, and then there's a preventative aspect.
Right. And we prefer the preventative because it shows proactiveness in the part of the patient. If you had a heart attack, you didn't suddenly have clogged arteries. They developed over time, and suddenly got to a point where now the body's giving you a shock warning that something is seriously wrong. So the same thing with other areas of your body, your spine, your joints, extremities in your spine. And it's better to get those before you get the shock warning, because that's the last thing that comes on. So the dysfunction happens first, and then the body will try to adapt as best it can, but there's a certain point where it cannot. And that's when you get pain, inflammation, dysfunction. And we'd like to hedge that before it gets to that point. And really, you do much, much better if you just stay ahead of it. And like you said, just like the oil changes, if you keep up with them, that engine can last 300,000 miles or plus. Same with the body. You can do many more things than others at your age level that haven't taken care of them. And we also know that it improves things like balance, flexibility, mobility. And as we get older, those are critical, more so than when you're younger.
How so?
Well, the proprioceptive feedback, which is so it's a type of nerve fiber that's throughout the body, higher density in some areas than others. But those are the nerves that talk to the brain and tell the brain where the part is in space and time.
It's perception. It's muscular perception.
Right. And it talks to the brain. There are fibers that talk to the brain talks to the fiber and talks to the part. And as you get older, some of that gets muddled if there's not really good communication between them. And some of that is a joint function or a muscle function where you're just not stressing it to the point to cause that feedback. What we do is provide that constant feedback to the brain. Hey, here we are. Remember, here I am. I'm the deltoid muscle. Here's what I'm doing.
It's recalibration.
It is a recalibration, constantly updating the brain. Here's what we're doing. The chiropractic adjustment, you think, is more just a joint issue. But realistically, and through much of the research that's been done more recently, is it's really a more neurologic procedure than an orthopedic type procedure, if you would.
I saw on a afternoon TV show some years ago, had a famous doctor on there, and one of the folks on that show suggested that the number one differentiator amongst the aged in strength, mobility, longevity of life was hip mobility. What say you to that?
I say it is important, but it's really just an indicator of what's happening throughout the body. It's just such a big joint that it's easier to see because it is so big and the movements are so grosser than other joints.
So there's a lot more that leads up to that,
right.
That immobility.
But if you just watch someone walk, their gait, this sort of thing, you can kind of pick up some clues that they've got issues. And if it's in the hips, it's going to be everywhere else.
Yeah.
So
starting down the foot
because the gait is the one thing you notice most, you're going to pick it up there sooner.
So I had my hip replaced like 9 months ago.
Wow, we're learning more about it.
I know.
We got more metal in here than I started a metal band.
I'm super fast on my right side. I typically run in circles. So, and my family would tell me all the time, "You're limping." Prior to that surgery,
yes,
they would say, "You're limping when you walk." No, I'm not. And they could see it in my gait.
Guys, this might be a good chance to take a quick break. We'll be right back. Hey there, if you're enjoying this episode, we've got a small favor to ask. Actually, it's a big favor. Take a moment to like and share this podcast with your friends and family. Then follow the Redirect Podcast on Spotify and Apple Podcasts. It's quick, it's free, and it helps us keep bringing you great content every week. And if you really want to make a difference, drop us a 5-star review. Those reviews help us spread the word and keep this community growing. So hit that follow button, share with a friend, and let us know what you think. We appreciate you more than you know. Now let's get back at it.
The gait really tells you a lot of story about the whole body. It's a state of what's going on, not just at the hips, but the knees, the feet, the spine, and elsewhere. The key thing is, as we get older, is to really concentrate on observing our body. What is it? What am I able to do? Why am I having restriction where at one time I was able to do that?
So for all of us 70-year-olds out here
Yes.
who have a lot of steel in us,
Yeah.
who maybe have had a heart attack or two,
Yeah.
chiropractic, too late for us? If I bring in this much steel, I've got this idea that the chiropractor is going to be maneuvering all this fused stuff.
Yeah. Well, for one thing, the fused stuff stays fused. It's the strongest point in your bone in the body. So there's nothing's going to break that free unless you're in a serious accident. The metal parts, obviously, you can do more muscle work with those to make sure that the muscles aren't so constricted around that new joint that they limit you and cause newer problems elsewhere. Because that joint, the muscle, has two contact points, right? One bone and to another bone. And so you may be restricted at one, but it could restrict the other.
Right.
If it may cross several joints, may restrict those. So we want to keep those mobile so that they don't fall into the same problem that the metal hip is now in.
And if we've already adjusted, let's say, the neck, the idea is, or the common thinking is, that eventually the pressure put on the discs above and below a fusion are going to go.
Yes.
And I'd love to,
It's a fulcrum.
I would
Right.
love
Yes.
to think about, hey, maybe that's not the case. Maybe we can do things that are going to prevent that.
Right. Well, the reason you have all these joints in your spine, there's 32 joints, is that they're all meant to work. They're not there to be passively watching the other joints do their job. So you take and you fuse a couple of those. Now you're asking the others to work harder,
Right.
to do the same, to get the same range of motion, if you will, out of that, your neck or what it might be, as it did before. So now that higher stress load is put on the ones that are on either side of that fusion, because intentionally, for instance, the neck has 7 vertebrae. Now you're knocking it down to maybe 4. That's a lot of stress
Right.
to ask of those 4 joints left. So those kind of things are you have to hedge and get ahead of.
Let's start looking to our listeners for a second. Well, they're not taking care of themselves now. Let's say their basis is status quo, right? They're just couch surfing, they're living, they're doing their best to get around. What advice would you give them to improve things for longevity?
Well, the first thing is to agree that they need to do something. There's a lot of folks around that need to do something, and they just never do. They make some excuses, but they really have no motivation to move forward. Figure out what is your motivation. What do you really want to do? What do you want for your life? And how do you get there? You find the right people to help you get there. Just like a new business, if you get mentors in that business to help, learn from their mistakes, not your own first. No. So you find professionals that can help you, a chiropractor, massage therapist, acupuncturist. You find these folks that can help you get into that realm of, I am purposely doing something for myself that I had not done to now, and I don't want to live like this anymore.
One other component that I think you have to be aware of, at least was important to me, is that having the history that I had, no disrespect, I don't like crackers. I get freaked out when someone cracks me. All right. And I've had chiropractors in the past that have done very severe manipulations, and I'm not comfortable with that. So when I met John through our Bible study, and then he was a chiropractor, and over at AIM, I'm like, yeah, I'm in. And that was the first thing I said to him. I said, John, I don't like to be strongly manipulated, and I'm used to this other tool that does, in my mind, is not as I'm going to say violent. I shouldn't say violent,
abrupt.
But
scary.
Abrupt. Yeah,
scary. Yeah.
And I think what's important too is that when you go in to speak with somebody, if it's your first time or if you have some concerns, to be upfront with how you're feeling about what's going on, as well as going there because now John is my guy.
So how do you weed through? If I'm a guy who's just listening to this podcast, and the conversation with John has compelled me to go do something about it. I'm going to call up my chiropractor. What question am I asking him to determine if he's going to just abruptly manipulate me for, the checkbook, or he's going to take care of me in such a way that the folks at AIM or John would?
Just like anything, you have to do your research. All right. There's multiple chiropractors out there. There's multiple different types of chiropractic procedures and the way that they do things. And I think you have to shop for one. And I'm fortunate that my wife and her family are very, very holistic in their health strategies. And they have a good understanding of people in the area that can do this. And we found it over at AIM. When I went in for the first time, I then said, okay, I know this is a good place, according to the people that I've heard from that are testimonials. And now these are my concerns, that I don't like an abrupt manipulation. I like the more subtle one, using this other type of tool that's more appealing to me. And it works for me. So I think it's important that a relationship component, and that's with any doctor or any person that's going to be a part of your life, your financial person, your health management, the estate planning, establishing relationship, I think is important, because then you have trust, and then you have a coach, and then you have someone that's going to be able to help you and be proactive in your health.
That's a great summary of this episode, honestly. If there's a soundbite that you can take away from that, it's a pretty good one.
And that's dead on of how we look at things at AIM. Is you're not just another body to adjust and move out the door. I want to get to know you. I want to know what your life is about and how can I make it better for you as another human being. And I want to know your fears. I want to know what's going on with you. I can't tell you how many times I've had a patient come in and they were hesitant just to have me touch them in any way, not because of fear of, the sounds of the adjustment or anything like that, but rather their history of sexual abuse.
Wow.
So you have to be aware of all kind of input you're getting from the patient as you're, trying to get to know them, not only get to know their problem, but get to know them. And many times it guides you so well on how to properly treat the patient, or whether I'm really the person that is best suited for them or not.
Wow. But within your practice, you're in a great position to be able to get them to the right person.
Right. Exactly. I've had some patients come in very acute pain. Yep. That's, with severe spasm. And normally that would be my kind of person, but they're just so acute that I will not be able to accomplish much initially. Mm-hmm. So it's nice to go to one of my MD colleagues and say, can you look at him real quick and see if there's something medicinally that we can do to get him out of this real acute hot phase so that I can do my work. And so many times they may prescribe something to them or give them an injection to calm that inflammation down so that my work is actually better rather than provocative.
And I want to put another plug into what John also does. We've talked about his chiropractics as well as the resources he has at AIM that can help with the well-being of an individual. But him, in working with me, had noticed things in my gait and my alignments, that my hip was off. And says, so let's take a look at your feet. So I'm like, okay, well, I took my shoes off, and he looked at my feet, and he says, now over on this machine. So he put me on this machine that did sort of a thermal imprint of my foot to show type of contact. When I saw that, I'm like, oh boy, I've never been flat-footed in my life, and now I'm flat-footed. So he said,
arches had fallen.
My arches had fallen. And he says, now here, let's try this orthotic to go inside of your shoe that will help you with your alignment of your foot to ankle to shin bone, which then, as we talked earlier, works its way on up. So he was able to assess that this is another device that I could use to help me in better aligning my legs. And I tell you, another good positive testimonial. Yeah. I don't have those pains in my hip as much as I used to. And, yeah.
Well, many people, and in fact, there's even chiropractors, most MDs wouldn't look. But now I've trained many of the MDs at AIM to start looking at the feet, and they send people over all day. But the importance of feet is overlooked so often. And I get patients from other offices that have been to chiropractic say, yeah, I love the guy. He does great. He gets me aligned. And like within a few days, I feel like I'm back out.
Yeah.
And I say, well, it's not his fault. It's your feet, probably. Because if you're going out on the same foundation that you came in on, things will drop into that fault. So that's what typically promote to look at the feet, and you'll see the fault in the feet and how the ankles form as you try to go through your gait. And what happens as that foot drops in, and most people pronate as you get older.
So
but as you pronate is rolling in the foot, right? So as you go into a flat foot sort of thing. So the ankle rolls in, and what happens is the lower leg rotates inward with it. So the first area of stress is the knee. So you'll tend to see a lot of folks with knee surgeries or replaced knees because the foot was never addressed. Same with the hip. Hip's the next point of stress, and then up into the spine. So think of the feet as a foundation of the house. If the foundation is shifted, where do you see the cracks? You don't see them down there. You see them up. First
second story.
Right.
Wonderful visual.
Right. So the stress gets higher as you get away.
It compounds and amplifies.
Right. So by correcting the foundation, now the adjustment I give holds for much longer.
Yeah.
Because there's a good foundation holding it. And now we've taken the stress off the knees, the hips, and the back that are there every day that really we can avoid that by putting in a nice orthotic that balances it out.
And so if for all those out in our listening audience who have neuropathy, if that is true, I mean, I probably have cracks all over my head. Because with neuropathy, it's either pain or you don't feel stuff,
right.
And I know that. And that all of a sudden becomes the primary focus of, hey, you gotta deal with this because it's going to continually affect everything else, especially as you get older and you stop doing it or do more than you should be.
Right.
Wow, that's a multiplier effect that I got to think would be pretty.
And then you got to think, what is the culprit? Because there's not just one cause for that neuropathy. Yep. You'll see it a lot with folks that have had chemotherapy. Or some other drugs will do that as well. Yep. You see it with stenosis in the spine where the spinal column and where the spinal cord is narrowed enough to cause pressure against the cord, diminishing that sensation to the feet, or even sometimes weakness as well. Yep. So you first of all find out what is the source, and then try to address it. And they've got really nice orthotics that help even with that as well.
So, John, man, we can't thank you enough for coming in, talking to us about all of this. It's been such an insight into all of the contributing factors that have led us to where we are, and it's been such great advice on how to make the best of what you have left. Yeah. And so we appreciate your time. If people want to get a hold of you, how do they get a hold of you or the Alliance of Integrative Medicine?
Well, they would call the office at 513-791-5521. One of our lovely receptionists would answer that phone and line them up to evaluate them, and that would be the best way. Oh, they also you can do some things online as well.
Yeah, totally. That website is aimforwellbeing.org. Dale?
After this great conversation, you want to leave everybody with one thought.
Well, the one thought, with aging, and we kind of touched on it, is just flexibility, strength, and mobility are the keys as we get older. Because a lack of any of those results in falls and injuries and disability. So work on those, and you have a less chance of getting hurt and a better chance of having a pretty sweet life.
So
That's
great.
Awesome.
Yeah.
Thank you, guys.
John, thank you so much.
Thanks,
John.
John.
Having you here today.
Loved it.
Appreciate it.
Thank you, guys.
We want to thank Gianna Damona and the University of Cincinnati 1819 Innovation Hub for allowing us to use the eSports recording studio to record our podcast. The Redirect podcast music is from Sound Gallery by Dimitri Terrace. Want more information on how to redirect your purpose in retirement? Check out the Redirect U website at redirect-u.com. Do you have something you want to share? Do you have a question about your redirect strategy? Please email us at info@redirect-u.com. We would like to hear from you. Check out the latest Redirect podcast episode, as well as see all the Redirect episodes on Spotify and Apple Podcasts. Remember, there is purpose in your life, so find it and go do something about it.